In the fascinating world of medical science, two conditions often mistaken for each other are subarachnoid hemorrhage and subdural hematoma. Both are serious conditions involving bleeding within the brain, yet they present with unique characteristics and require distinct approaches for treatment. A subarachnoid hemorrhage occurs when an artery on the brain's surface ruptures and bleeds into the space between the brain and the skull, known as the subarachnoid space. This condition often strikes like a thunderbolt without warning. The sudden surge of blood into this space, filled with cerebrospinal fluid, increases pressure on the brain and can cause severe headaches, nausea, vomiting, and even loss of consciousness. On the other hand, a subdural hematoma involves bleeding on the brain's surface, beneath its outer protective layer, the dura mater. The bleeding usually results from a head injury strong enough to burst blood vessels. Unlike subarachnoid hemorrhage, subdural hematoma often develops slowly over days or weeks, leading to gradual onset symptoms such as confusion, drowsiness, and sometimes persistent headaches. Comparatively, both conditions share some similarities. They both involve bleeding in the brain and can be life-threatening if not treated promptly. Both can cause severe headaches, changes in consciousness, and neurological deficits. However, the location of the bleeding, the speed of onset, and the causative factors are what set them apart. In subarachnoid hemorrhage, the bleeding occurs between the arachnoid and pia mater, the innermost layers of the brain's protective coverings. It's typically caused by a ruptured aneurysm. The onset is usually sudden, and the severity of symptoms can escalate quickly. In contrast, a subdural hematoma happens between the dura mater and the arachnoid mater. It's usually the result of a head injury, and symptoms often develop slowly. It's not uncommon for a person with a subdural hematoma to initially feel fine after a head injury, only to experience symptoms days or even weeks later. In summary, while both subarachnoid hemorrhage and subdural hematoma involve bleeding in the brain and can present with similar symptoms, the key differences lie in the location of the bleeding, the speed of symptom onset, and the typical causes. A subarachnoid hemorrhage occurs in the subarachnoid space and is often due to a ruptured aneurysm with a sudden onset of symptoms. Meanwhile, a subdural hematoma occurs between the dura and arachnoid maters, usually resulting from a head injury, with a typically slower development of symptoms. Understanding these differences is crucial in the medical field, as it aids in accurate diagnosis and appropriate treatment. So, next time you encounter these terms, remember, while they may sound similar, they each tell a different story in the world of neurology.